Good morning, everyone, and welcome to my presentation on Fragile X syndrome. My name is Johanna Strong, and I'm in the Care of Adults in the Primary Care Setting, Part 2, and I go to Georgia Baptist College of Nursing at Mercer University. Okay, so Fragile X syndrome is referred to by many names. It's called FXS, Martin-Bell syndrome, Marker X syndrome, X-linked mental retardation, and macroorchidism. It's an inherited X-linked dominant disorder caused by a genetic mutation on the X chromosome. It's more common in males, affecting roughly 1 in 4,000 male babies and 1 in 8,000 female babies. Symptoms are typically more pronounced in the males as well, but females do get symptoms too. Some genetic risk factors include having a parent with the FMR1 gene mutation, and the prevalence is higher in people of the European descent. There are no known environmental risk factors, but going into the nature versus nurture, there are specific behavioral modifications that can improve the quality of life and disease progression, especially if it's initiated early in life while the brain is still developing. But currently, there's nothing out there that causes the disease to get worse. So common presentation of Fragile X syndrome includes a long narrowed face, large ears, prominent jaw and the forehead, unusually flexible fingers, flat feet, and males can have enlarged testicles. Some common behavioral characteristics, which is what the disease is commonly known for, is anxiety and depression, learning disabilities, autistic-like behavior, and it's also associated with an increased risk of developing disorders such as primary ovarian insufficiency and tremor ataxia syndrome. Some common medical complications that can develop later in life may be excuse me, hypotonia, GERD, strabismus, seizures, sleep disorders, joint laxity, pes planus, scoliosis, recurrent ear infections, and then cardiac conditions such as mitral valve prolapse or aortic root dilation. And as you can see here, this is a common futuristic picture of a little boy with Fragile X syndrome. So lab findings and red flags, there's not really any abnormalities found within a normal lab panel such as a CBC or BMP. Most of it is found via genetic testing. So a pregnant woman who knows she has Fragile X syndrome can have genetic testing done during the pregnancy to detect the FMR1 gene in the fetus. And this can be done via blood draw, amniocentesis, or chorionic villi sampling. But most people don't know that they have the mutation. So prenatal testing isn't as common. The most common way people find this disease is they notice the behavioral symptoms in their kids around 36 months for males and 42 months for females. And the common red flags that warrant testing is delays in the development of speech, language, and motor skills, and then if they have social or emotional difficulties. And the diagnosis needs to be made by a clinical geneticist. So for us in the primary care setting, we need to refer these patients out. So the European Journal of Human Genetics published some clinical guidelines for diagnosis and treatment. This is the EMQN best practice guidelines. And this was published online in September of 2014, and they printed it later in their journal in April of 2015. And there is yet to be any updates on these guidelines. Excuse me. Because the clinical symptoms are inconsistent and nonspecific, um, genetic testing is typically done as like a basic genetic panel in children with the developmental delays. And again, there's no cure, but interventions such as cognitive behavioral therapy, occupational and speech therapy, IEPs, and pharmacologic symptom management can greatly improve the quality of life for the patient and family. So based on these guidelines, there are a few options for diagnostic workup. You can have the molecular diagnostic analysis, and this is the most accurate. It has a 99% sensitivity and specificity. And this basically looks at the number of CCG repeats, and it determines the number of times that the mutated gene is repeated. Typically, 50 to 54 of these repeats are associated with full mutation and presentation of the syndrome, while 45 to 49 of these repeats suggest that the individual may only be a carrier. Some additional tests include the Southern blot analysis. This identifies the number of expansions of the same CCG repeats, and it also looks at the myelination status. And it uses an enzyme known as the EcoRI, I think I'm saying that right, to detect full mutations and then large pre-mutations. The PCR testing, this one's a little bit quicker. It determines the accurate sizing of the pre-mutations, whether they be large, all the way down to pre-mutated alleles, and it assesses the risk factor or risk of females passing this gene down to their offspring. Prenatal diagnosis may be done as well. As we mentioned before, this can be done with the chorionic villi or the amniotic fluid cell cultures, and it can also be done with blood draws. So these are a few online resources available to families who have this genetic disorder. The Genetic and Rare Disease Information Center has a great informational page, and we'll look at these in a second. The National Fragile X Foundation also has a list broken down of community resources through different types. And then the American Academy of Pediatrics, this one's actually my favorite, has a great informational guide for parents, and we will actually visit these. So the Genetic and Rare Disease Information Center, this is their page for Fragile X syndrome. It goes into the disease at a glance, breaks it down into symptoms, causes, and then next steps. So the symptoms, I really like this because it gives the medical term and then also breaks down the description of the symptoms into more simple terminology for people who may not have medical background, and then also describes how frequent each of the symptoms are. And it goes through all the body symptoms, goes through the genetic causes of the disease, and then discusses things that you can be prepared for when you go to your doctor's office and visit with your medical team. And then next is the Fragile X organization, resources for living with Fragile X disorder. There's a lot of educational resources, apps for your smartphone or tablet to help with education. There's so many. Individual education plan, books and DVDs, websites, and then some additional resources to help learn math and reading. If they have any questions about their sexuality, there's also resources for that. and then learning about writing. They also have resources for homeschooling, lesson plans, therapy, medications, life planning for adults with Fragile X syndrome, college, community living, literally so much. And then this one is the American Academy of Pediatrics resource page. It puts everything, I think, very plainly for parents. So this is just kind of a general overview of the disease, symptoms, and then myth busters for families. So one of them, I thought girls couldn't have Fragile X syndrome and boys always have severe symptoms. And it says this is false because both boys and girls can have the disease. And then symptoms are typically more severe in boys. What to do if your child has been diagnosed with the disease. And then another list of additional information and resources. So there is a lot of information out there available for families. And this is my list of references. That is all. I hope you enjoyed this presentation and learned a lot about Fragile X syndrome, its causes, symptoms, and references and how to deal with the disease. Thank you.